Namaskar. Greetings from IIDL NAPCM. Myself Dr. Geeta Joshi. I am Director of International Institute of Distance Learning, which is a training division of National Association for Palliative Care for Ayush and Integrative Medicine. I am also Chief Executive Officer of Community Oncology Center situated in Ahmedabad, Gujarat.
Yeah, I'm Dr. Joshi, Yashwant Joshi, and I'm the Vice President of NAPCAM, that is National Association of Palliative Care for Ayush and Integrative Medicine.
Hi, I'm Dr. Piyush Gupta. I am Secretary of National Association of Palliative Care for Ayush and Integrative Medicine and a special point of contact of International Institute of Distance Learning and National Association of Palliative Care for Ayush and Integrative Medicine. Dr. Geeta Joshi is Course Director and Director of IADL. And I am also Secretary of Cancer Aid Society, which is working since last 35 years across the country. So I would request Dr. Geeta Joshi to kindly take the lead.
I like to.
For Dr. Geeta Joshi sage, our discussion will be basically revolving around 3 points. So that this should be a very free and frank discussion.
Yeah.
3 points. What is the importance of this particular course for which we have a tie-up with NPTEL? Number 1. Number 2, how does it benefit our Indian society, our intended audience? And number 3, let's clarify so many myths and facts about palliative care in Indian environment. So these 3 central themes are there. And we'll be generally taking about 15 to 20 minutes. So that is the thing like that, you can start.
Great. So basically, how is palliative care going to benefit the common man is the concern of Dr. Colonel Yashwant Joshi. And Geeta ji, now can you add to it?
Yeah. Palliative care is a holistic care given to a patient who is suffering from chronic illness. And palliative care is treating a person as a whole, not only the physical part, but his emotional part, his psychological part, his social culture, his spiritual background, and all this is treated simultaneously. So it is a very important subject where not only doctor and nurses are involved, but any person who is treating such patient can be involved, and that person can be a psychologist, a counselor, a volunteer, a psychiatrist, or any person who has got attitude to learn this speciality. So anybody, whether you are a student, college student, you have just passed out and joined a job, or if you are a house manager, or you are a big executive of a company and involved with many CSR health related activities. If you are a part of a NGO who is working in health related activities, and so any person who has got attitude to learn this speciality can be involved in doing this course. This course is Foundation Certificate Course in Palliative Care. It is a joint venture of NPTEL and NAPCM.
Thank you, Dr. Joshi. Colonel Joshi, would you like to add anything?
Yeah, like what Dr. Geeta Joshi has said, palliative care. Basically, palliative care is a teamwork. And to roughly, I'm not a medico, but just as a layman, if I say it consists of so many team members. On one side, they got a highly qualified specialist, pain management specialist. At the lowest side, they got people with rudimentary knowledge, normal, and they are nothing but they are the family members of the ailing patient. And in the middle comes the nurseage. If we just see, then almost about 40 to 50% of treatment can be done by family members. In our terminology, we call them caregivers. And therefore, this course is beneficial to anybody. There is no requirement of any study, graduation, this or that. It is just not required. If you are interested in the welfare of your family, because sometimes somebody is going to fall sick in any family. There is not a single family anywhere in the world where nobody falls sick. You can have something like longer term of illness, and that is where our family members can act as caregivers. By doing this course, they will understand the nitty-gritty of being a volunteer, being a social worker, being a caregiver for the palliative
Yeah.
care.
Yeah, you are
Yeah.
very right, Colonel Joshi, because there is a importance of caregiver in palliative care. Palliative care, that is a care of any patient, is not given by only doctor and nurses, but the person who is continuously with the patient, or he may be a family member or spouse or brother or sister or anybody, and he has got a very important role to play. He should know almost everything about the disease, its stage of the disease. He should know which medicine to be given when. He should know about how to take care of the hygiene of the patient. He should know how to do wound dressing, giving oral care, and so many other issues. So there is an importance of caregiver. So even if you are a common man living in a family, whether you are a wife, husband, sister, daughter, brother, anybody, or uncle, if you learn this course, you are going to be helpful to your family members, your neighbor, or your in a society as at large.
Light on quality of life,
Yeah. Thank you, sir. To sum up, I think palliative care, when we are talking, involves 25% medical, that is addressing the symptoms and physical components of the patient, and 75% of it is non-medical, that involves social, psychological, and spiritual aspects of the patients. And not only the patients, again we are talking about caregivers. Caregivers means those family members or those people who are attending the patient and serving the patient, because 24/7 you cannot get any medical attendant to do it, because it would be very expensive. Again, palliative care is the non-commercial aspect. So if we want to make it cheap, we have to train the caregivers, that is most of the time the family members or the nears and dears one, to take care of the patient, and palliative care people are there to help them out, groom them up to take care of the patients. So rightly said, each and every person in the society needs to learn palliative care. Let us not go by the big word palliative care, but it is simply caring for the patient. It may be, the patient may be having long pain which is not going to be treated. So he needs it may be not only physical pain, but it could be a mental pain also. So palliative care professionals, they provide counseling, they become friend of the patient, guide them, and this decreases not only the physical pain but also the mental pain and distress of the patient. So Geeta ji would like to add anything?
Yeah. Secondly, in India, there are many patients who are suffering from chronic illnesses, and they are from the rural area, from the poor resource setting. Palliative care is a low technology and high care system. So if anybody who learns palliative care, they don't need any technology, hi-fi machinery or injections on drug. They just need to know how to care. Like example, Suppose a patient needs dressing of the wound every day, and if he is living in a rural area, he doesn't have access to a dispensary or a doctor or a nurse in that area. So if a caregiver, his family member, learns the dressing, it is very simple thing which they can do at home every day, and patient will be benefited. So palliative care can also be practiced in poor resource setting area and even rural area. That is why everyone should learn palliative care.
I'd like to put just final point about the palliative care. There are two terms we must talk about. One is the quality of life, and second is the quality of death. As has been already pointed out by Dr. Piyush and Dr. Geeta Joshi, that consists of so many team members, and particularly social workers, caregivers, they play an important part. Medical part is little less. I can't give you in figures as such. When it is being given by social people like social workers, caregivers, that's the family members, definitely quality of life goes up. And secondly, coming up to quality of death. Normally, if you ask anybody when and where he wants to die, when he can't say, but where, yes, he can say that I generally want to die at my home, and I don't want to be locked up in a ICU, number of tubes are there around me. So when I want to die at home, and if my own people, my relatives, my closed one, loved ones, they are around me and then they are giving me some basic nursing treatment to me, I'll be more than happy. I'll leave this world with lots of happiness. So quality of life and quality of death increases, and in fact this is what is happening in our society. It is being taught to us since childhood that we must help everybody, and the family should be a cohesive family, and therefore this palliative care system is very, very appropriate for
Indian
Indian
setting.
scenario.
Yes. Very
Rightly said. And I would like to again add to Colonel Joshi that when we are talking about quality of life and quality of death, again, the cost of death is very important, because nowadays, even the terminally ill patients, the old age patients, they are dying in ICUs and on ventilator, which is virtually bringing the entire family on the verge of financial collapse. They sell their everything, and the entire family comes to the footpath. Dr. Geeta, would you like to
Yeah.
comment on it?
In palliative care, there is a specialization end of life care. When it is sure that this person is not going to get cured of his disease and likely to die, then the role of palliative care also very important. In India, almost 80% of family go below the poverty line because they spend so much of money during this period of end of life. Even if patient is suffering from advanced stage of cancer, advanced stage of renal disease, liver disease, old age, then also patient is taken to the ICU, put it on ventilator, and lots of money is spent unnecessarily, which can be spent to the people who really needs that care. So coming to this end of life care, that if during this period, by counseling and communication, patient and family are prepared to accept the death, and death is taken as a natural process, inevitable but natural process, and patient is allowed to die naturally at home in amongst their loved one, and with all his pain and symptom is relieved, and all his nursing issues are taken care of.
Thank you, Geeta ji. Colonel Joshi.
Yeah, we are already on the subject of palliative care. I think let us discuss little bit about the myth. कई एक गलत फहमियाँ हमारे समाज के अंदर चल रही है. This is from the doctor side also, and this is from the patient side also. Can you just see?
Yeah, there's a very common myth. When we are taking a patient to a treating doctor, and many a times, if he refers the patient to a palliative care professional. So we think that now this is the end. There is nothing which can be done. Geeta ji, can you speak on this?
No, that is not the right way of thinking. Palliative care starts right at diagnosis of such chronic illness like cancer or heart failure or liver failure. Initially, palliative care is a complementary care. It can be given along with the other disease management treatment. Suppose patient is on chemotherapy or undergoing operation or radiation therapy, then also palliative care can take care of that patient. Uh, by referring to the palliative care, patient and family member will understand the disease properly. They will accept the diagnosis, they will accept the treatment they are offered, and there will be more compliance. It referring to palliative care or going to palliative care doctor doesn't mean that it is end of life and you will not be treated by other specialists anymore.
So this particular taboo, the myth must go, because most of the people either they know nothing about palliative care, otherwise they know something like this palliative care means end of life treatment. Palliative care is given only when patient has pain or other symptoms.
No, it is not right. As I said, that palliative care is not only physical care like pain management or symptom control or giving injections or giving medicine. It is not that. Palliative care also includes addressing the psychology of the patient, social culture of the patient, his myths and his beliefs in spirituality and other system of the healthcare. So even if the patient is all right, doesn't have pain or other symptoms, he can be referred to palliative care, where palliative care team will make him understand about his disease process, type of treatment he will be undergoing and all that. So any doubt patient has about all this can be discussed with the palliative care team. So patient can be uh, asked to see palliative care team members even if he doesn't have pain or any other problem.
So, in fact, the palliative care professionals not only address the physical component, as I discussed earlier, but they are also targeting the social, spiritual, and psychological component of the patient. And this leads to improved prognosis. Even in treatment, many a times there may be depression with the patient, and he may not be taking food or maybe medicines timely, whereas interaction with the palliative care professionals motivates the patients, so as the patients, they are not depressed any longer, and they basically want to enjoy their remaining life.
Yes, very
Yeah.
right. पीयूष जी, आप बताना चाहेंगे that palliative care is only nursing care and counseling and all such thing and no other treatment is given?
Not at all. When we are talking about the holistic approach, we are talking about all the components. It is not only nursing, it is not only medical, but many a times we are addressing each and every concern of the patients. For example, let's say many a times these chronically ill patients, their family members do not even talk to the patient. What do you want? He may be wanting maybe a laddu of 15 rupees, but he is deprived of that, and we spend 1.5 lakh rupees spending in ICU. What is better? So we have to consider the wishes of the patient. The patient is the master, and we all need to honor his desires. So do you want to add anything?
Yeah. In addition to that, you see, there is a concept of total pain. So far only we knew one term, pain. Pain. If something happens to me, if I get hurt in my knee, I have got a pain in my knee. I cannot walk around. But now a total pain consists of physical pain, mental pain, emotional pain, social and financial pain. Everything being included. So When you want to deal with social, financial, emotional pain, that is where palliative care comes into action, because ours is a team.
Yes,
So when you
multidisciplinary.
talk about total pain and when you accept this particular concept, then only you can understand palliative care. Otherwise, you will not. Your mind will just remain in physical diseases, illnesses, and other things, and not about psychological support, social support, financial support, and spiritual support also.
So when we are talking about this psychological, social and spiritual support, you can make the difference. You, your family members, your neighbors, they have to join hands and empower the patients so as to give these supports. They require no technical aspects, no money, but simple. You have to learn it up. You have to have empathy. You have to get compassionate so as to become a palliative care professional and guide these patients, help these patients, become a friend of the patients. Geeta ji?
What about the terminal stage? That is, there is a myth, that when patient is about to die, and we can call it terminal stage, and normally that's the time that palliative care treatment should be given.
It is not right, as I said earlier, that palliative care should be started right at the diagnosis of the disease, and particularly long term disease. So when patient is dying, definitely there is a role of palliative care. We have to prepare the patient, family, provide proper counseling and communication, and planning out the death of the patient and everything. That is different thing. But no, palliative care is given right at the diagnosis. Hence, the rapport will be established between the patient, caregiver, family members, and palliative care team. So whenever they need, they can approach the team and they can get guidance and counseling.
Another issue is related with this terminal stage is that a lot of people, they feel that palliative care hasten the death of patient. No, it is not. It's not a question of hastening the death. It's rather a question of giving a quality of death. Palliative care, from diagnosis of an advanced illness until end of life, and the goal of treatment remains just to relieve suffering and stop futile intervention. That was pointed out earlier.
Yeah.
If you know, and generally we come to know that end is near, nothing can be done, no further. You see, curative treatment stops somewhere, and that is when the palliative care treatment must start,
Yeah.
and that is where you can cut down the cost. Can you say something on euthanasia and that's
Uh, Palliative care doesn't hasten the death. It prepares the patient and family to accept the death and allow the natural course of death to take place. So it doesn't hasten the death. In euthanasia, the intention is to kill and to hasten the death. Here, the intention is not to prolong the
Prolong.
death with unnecessary intervention, not to shorten the death, but allow it to happen naturally. Piyushji, anything about euthanasia I would like to say?
Rightly said, because many a times people get confused. When we are talking about palliative care, people start talking about euthanasia, suicide, and so many things. Remember, a person who wants euthanasia, who want to do suicide, if they get a palliative care professional, they'll change their view. Why? Because they are full of empathy, they are full of compassion, they'll understand. Because palliative care professionals, they are good listeners. Normally, what happens, we continue to speak to the patient, and these patients are already withdrawn. So they don't come out what they are having within themselves. And the palliative care professionals, they are professionals in listening and finding out what the patient wants. And once the patient is satisfied, that dissatisfaction, that disgruntlement goes away, and the patient becomes calm and he accepts the life, whatever it may be, small or long, but the quality of life improves. Do you agree with that?
Yes, as I said, it is to improve the quality of life. So towards the end of life, when patient is dying, he will be having many suffering. He will be in distress. So palliative care treatment, whatever is given, it is to relieve this suffering, make him comfortable, make him comfortable at home or in among the loved ones, and allow the natural and remove the futile intervention. Like if patient is already of advanced stage of cancer, he need not put into the ICU or on ventilator or given oxygen or anything. He should be allowed to die peacefully at home among the loved ones with proper pain management and proper symptom relieved.
So maybe I'll just share an example, and I'll leave a question to you. On our helpline, one of the family members, caregivers, rang up, and she was asking that her father is a terminally ill patient, and he is having maybe in coma since last 1 year, and he is on active oxygen support. No response, nothing, but this active oxygen support is given since last 1 year, and what to do, because he is not active, no response is there, but the treating doctors gave oxygen. The patient is at home, he has to go every month to the treating hospital for interventions, comes back to home, but there is no response, and now the family is frustrated what to do. Can any doctor come and remove this oxygen? So why do you want it from the doctor when you have taken the patient on oxygen? Now how can a doctor come and do it? What is your advice? I actually feel that it was a wrong decision that they took the terminally ill patient on oxygen, and maybe you can as an expert add on to this.
Any doctor or any paramedics has got right to remove the futile intervention, the intervention which is not necessary. When the patient is dying, oxygen doesn't help. So by confirming this, that oxygen is not going to is not prolonging his life, or it is a wrong belief that by giving oxygen you are prolonging life, which is a wrong belief. Many a times it is just mechanical thing, and it doesn't improve the oxygenation. In this case, patient is unconscious, but family members and doctors can have a meeting, a proper communication, counseling, and with everybody's consent, the oxygen can be removed.
So again, but if you go to the treating doctor, would he suggest removal of oxygen? Probably
But
no.
but because he has not studied palliative care. If he has studied palliative care, definitely he can do this.
Just for the audience, information of the audience that euthanasia bill has been already passed by our parliament.
Passive euthanasia.
It's a passive euthanasia.
Passive euthanasia.
You can study the provisions and other things.
So passive euthanasia means a person is not active. He is not responding. He is in coma. And maybe we keep this patient for years on ventilator. So is that ethical? Because the family is shelling out maybe thousands of rupees every day to keep this patient alive, and so many members of the family come on the verge of financial collapse.
I
Would
think
you like to add?
this is a very long discussion, and very
okay.
confusing. Let us
Achha,
restrict
another
it
issue,
over here.
Dr. Geeta Joshi, should we palliative care is the only for people with cancer, suffering from cancer?
Yeah, initially, the palliative care was started only for the cancer patients, but now with the in this new era, there are more of a non-communicable disease prevalent. Initially, there was more of a communicable disease. Nowadays, there are more of a non-communicable disease, or we call it lifestyle disease, like hypertension, diabetes, kidney failure, stroke, heart attack, and ulcer disease. All these diseases are long time disease, chronic illnesses. So at one time or other, patient has pain, very difficult symptoms, he is in distress, he is suffering, and that is why palliative care is required. Even old age people, now the life expectancy has increased tremendously. So during the last few years of life, like 5-10 years, this old person is likely to become disabled. He is likely to suffer from some lifestyle disease like hypertension, diabetes, heart attack. So he will need palliative care. So palliative care is for all non-cancer patients also, including HIV/AIDS, or kidney failure, liver failure, heart failure, old age, and even pediatric patients, children. They are suffering from many a times cancer and many other neurological illnesses, paraplegia, and all such patient needs palliative care.
I got another point, because after all, we are we are trying to introduce this course on NPTEL. Basically, we want larger audience must do this course, and these two words, palliative care and hospice, how can they understand, at a lower level?
Yeah.
Can't we translate these words in the language which people can understand? Other stream medical disciplines people can understand, but when you talk about palliative care, people do not
So
understand.
other disciplines also people never used to understand previously, like anesthesiology or orthopedic, but now with the passage of time people have understood. But palliative care, yes, it is still very new word and terminology, not only among lay person but also among many paramedics and medicos also. The word palliare has come from Latin word. Like all in our medical training, many words have come from Latin word, and it is difficult to understand. So the word palliare means covering something to make it appear less offensive. So covering something to make it appear good. Here, a person who is suffering from such a disease which cannot be cured, you are relieving his suffering, relieving his distress, relieving his pain, and trying to improve quality of life of the patient. So that is why the word palliative care has come into the existence. हमारे गुजराती में हम उसको राहतदायी सारवार बोलते हैं, या तो हिंदी में प्रशामक उपचार बोल सकते हैं, बट फिर भी all these words are still new among medical fraternity as well as in lay person. Second word is hospice. Again, it has come from the Latin word. It means shelter, और हम हिंदी में बोलेंगे आश्रय. So hospice is that type of shelter where advanced stage of patients are admitted, and they can live in that shelter till end of life. So it is not a hospital, not a home, but it is an institute in between these two, where this type of patient can stay with that one of the family member or caregiver, and they are given palliative care till they die. Is it clear?
Yeah, another word. There is a caregiver.
Yeah,
You see,
we have been taking,
we have been taking this, taking the name of this particular word, caregiver.
Yeah.
And we insist that this palliative care treatment can be given by the family members. Can't we introduce something what people can understand? If I want to treat my people, my own family members at my home, I don't want to look like a caregiver. I'm the part and parcel of the family member. So, can we Indianize certain issues so that people accept it very fast?
Rightly said, Colonel Joshi. Because again, I am a family member and I am caring the patient, but I am called a caregiver technically. I no more remain a family member. So maybe we when we are talking about empathy and compassion, the word should relay that empathy. And probably since we are caring the patient, this caregiver word has arisen. So Geeta ji may add on this.
Yeah. A caregiver is that person who is continuously with the patient and knows everything about the disease of the patient. He is the person who takes the patient to hospital, talks to doctor. After coming home, he gives medicine to the patient. He continuously talks to patient what he is having problem or not, all such thing. So caregiver can be a spouse, brother, sister, a family member, or a friend also. So anybody can become a caregiver. Secondly, palliative care believes in empowering this caregiver. We don't give importance, or we don't only talk to patient, we talk to patient as well as caregiver. Caregiver is educated about the disease of the patient, about the treatment of the patient, about the care of the patient, about maintaining hygiene of the patient, about giving medicine of the patient. So we empower the caregiver. At the same time, when one person is continuously looking after the patient, he himself is also tired. He has physical issues, he has psychological issues, he is depressed, and also think we address the caregiver's issues also. If you are doing this course, you will learn to know about the importance of caregiver. And that is why this course is such a wonderful course that anybody is will be benefited by this doing this course, because in our life many a times we have to become a caregiver, not only for our family member, sometimes for a friend, sometimes for a neighbor. So there is a very important role of caregiver, and this caregiver are highly educated, empowered, and they are well aware about everything.
Colonel
So, in
Joshi.
short, this course is meant for everybody.
Yeah.
It is meant for everybody, family members, students, and professionals. In fact, if you do this course properly, sincerely, m- complete the enrollment, go through the assignments, then I'm certain two things what we always talk about, and we are very low in comparison with other nations. That is the quality of life and end of life care, quality of death, we'll call it. This will increase. Thank you.
So, finally, to sum up, we all know about Sustainable Development Goals, SDGs 2030. Goal number 3 is good health and well being. We have already seen the havoc played by COVID 19, which has brought the entire globe to a standstill because we were not conscious about our health. Probably now we have got a bit conscious towards our health. So we are addressing the goal number 3, that is good health. But when it comes to well being, what is well being?
Yes.
Well being points towards the quality of life. When we are talking about quality of life, it is none other than palliative care. And let us know about palliative care. Let us tell others about palliative care. And that is how we are going to address the goal number 3, that is good health and well being amongst all the countries. Geeta ji.
Yes. As per WHO, health doesn't mean absence of disease. Health means overall well being, that is physical, psychological, social, financial, spiritual, everything. So, a person is not only physical, it has a emotional aspect, it has a psychological aspect, he has got a mind, he has got a heart to feel, he has got a society to live, a family to live with, he has got certain financial aspect, and he has got spiritual aspect. So palliative care believes in overall well-being, holistic health, total care, and ultimately improving the life of the patient.
Would you
And
like to
yeah,
tell
you
about
also sum
respite
up?
care, Colonel Saab?
I think this is enough. Respite and other things, that will become a theory part of it.
Yeah.
Okay.
Our aim has been served. We wanted to tell the people that this is a fantastic opportunity to become a doctor. You can become a doctor just by studying palliative care. You can become a doctor by being a social worker. You can become a sort of doctor by being a caregiver. And this thing gives you an opportunity, isn't
One
it?
last point. This will increase your confidence in handling any person who is sick around you. You will not hesitate taking him to a doctor. You will not hesitate visiting a hospital. Many of us avoid visiting a hospital, but it is very important when a person is sick, right? So after once you do this course, you will not hesitate. You will have confidence. You will be empowered, and you can take responsibility of anyone who is sick or who is disabled or who is suffering from long-term illness. Thank you.
So
Thank
just I'll add on to Colonel Joshi that when we are talking that you become a doctor, that is, you don't become a medical doctor and start writing prescriptions,
No.
but technically you become a caregiver.
Caregiver.
Fine. So you don't have a phobia with the doctor.
Yes.
You can discuss many things with the doctor, which normally they don't discuss with the patient or their relatives. So you become empowered. You become technically a caregiver, and you know more about the medical aspects of the treatment and caregiving. Thank you.
Thank you.
You become the part of the same medical system as such.
Yeah.
palliative care.
Thank you.
Yes.
Thank you.
Thank you.